Musculoskeletal disorders. Okay, overall review, again, this is anatomy, physiology of 206 bones in your body, all different types, all different locations in the body, and different parts of the bone. The epiphysis, metaphysis, diaphysis, different, what's the middle part of the bone? Let's put that with bone marrow. Which part of the bone is that called? That's kind of the point one that we're talking about. No, which of those three are the middle part of the epiphysis is what? The ends, like the epiphyseal plates, that's right. Yes, the meta is the middle part, exactly. The joints, sympathetic, amphipathic, and diaphragmatic are just the way that they can move, and then different types of muscle and where they're located. Again, just kind of a review of that system. These are tests that are done to check if there's any issues. Any of those look unfamiliar to you? Or again, MRIs and CAT scans are going to show tissue, soft tissue, as opposed to x-rays. And then overall differences, when we talk about bones in the infant's body, well, obviously we know the cranial bones are soft and separated. You have fontanelles. Muscle fibers are all present during gestation, but their size will increase, obviously, as the infant gets older. And until puberty, the ligaments are actually stronger than the bones, which means that they are less likely to have fractures with bones. Rapid bone growth during puberty, and the epiphyseal plate is eventually replaced by bone. And that's when we know that growth has stopped occurring. Okay, so as long as you still see that little line, which is the epiphyseal plate, that means growth is still occurring. They say somewhere about the age of 25 in males is when they start to close off. And in females, it's more around the age of 20 to 22, a little bit earlier in females.
What's this? I mean, what's 18 at girls and 21 at boys?
They say, yeah, somewhere, I think your book has like 20 for girls and 25 for boys. So, I think it's just the references, but yeah, overall that's when it ossifies, there's no more growth that'll occur. Immobility, just like it has a profound effect on adults, has a profound effect on children and infants too. So osteoporosis is not just an older disease. People sometimes say, oh, osteoporosis, how's a child of that? Well, many children, especially like at children specialized when they're immobile, can definitely have osteoporosis.
What if you take prednisone?
That's absolutely right.
Yes.
Steroid.
Steroids.
3 months ago.
Yep. Good thing to remember. So, again, fracture, things like prednisone, things like immobility do cause that effect on the demineralization of the bone. Features of a child's fracture not observed in adults. They have the presence of the growth plate. So there's something called the Salter-Harris. There are two doctors, Salter and Harris, that actually classify how bad the break is in the epiphyseal plate, and that's going to determine whether there will be continued growth in that bone or not. If there's a complete fracture, like a level 5 through the bone, then it's highly unlikely that any more growth in that bone will occur naturally. A thicker and stronger periosteum, the porosity of the bone, it's very porous. The bone is very porous. So when you think about, think about, for example, a stick. If you find a stick on the ground, where it's autumn, or we just got through autumn, so you see a lot of twigs and sticks. If you find one on the ground and you pick it up, and you go like this, it snaps, right? Well, that's what you want to think when you think of someone who's older and their bone, less porosity. But if you take like a branch or a little stick off of a tree, right, and you try to bend it, it's much more bendable and flexible. And if it does break, it's going to actually splinter more likely than it will break completely. That's how children's bones break. They break in a way that's actually called, that's right, a green stick. Don't look at the spiral for a minute, but look at the green stick. They actually splinter. They don't break completely apart. And when I try to use the analogy, I try to say, think of a stick, okay, because they're very moist and porous. As we get older, we dry up, right? The bones become very brittle. We know, right? Brittle, you go like this, it's going to snap. Think of that twig that's been lying on the ground for a while. It's going to snap. Whereas if you pull something right off the tree, it's very moist, very porous. It's going to just, when it does, it's going to splinter or not break completely. And that's the difference there. Other differences, participation in sports predisposes to injuries such as contusions, sprains, strains, more so even than fractures though, because they do have the ligaments that support them. And then traction. I know you did traction in 132 or 131, but again, some things you want to remember, you never release skeletal traction. Skeletal traction are like the pins that come out of the bone that are stabilizing it. And the purpose of traction is to stabilize the bone in alignment so that healing can occur. That's truly what it is. And obviously, you always want to check. You always want to check the proximal areas for the 5 Ps. You know, so you want to check for pain, pallor, pulselessness, paresthesias, and paralysis, because you want to make sure. You know, for example, you want to check the foot if there's a fracture of the tibia, something like that. For those things, whether it be in a cast or whether it be a cast is another type of traction actually, but whether it be in a cast, whether it be in skeletal traction, whatever it is, you always want to make sure you check the peripheral area to make sure that you don't have any of those 5 Ps, which should sound familiar from previous courses, correct?
Atrial insufficiency.
Well, they're indicative of improper blood, improper circulation, nerve or vascular involvement. You know, yeah. So again, you know, you're having issues with, if it's a compartment syndrome, you're having issues with circulation to the area. And so any of those things, because what can happen is if you have problems with circulation in the area, then what? That's right, eventually you have necrosis, nerve damage, permanent tissue damage. So obviously you want to avoid that. Fractures are the most common musculoskeletal injury in childhood. Spiral fractures, okay? Actual fracture that was twisted. What does that mean? Abuse. Spiral fractures have to be evaluated for abuse. I have had cases where spiral fracture has not been abuse, but it should always be evaluated for potential of abuse. Because it is a twisting motion, it doesn't happen actually naturally. I 2 cases that I can most recently think of, and one of them being a very young woman was walking out of a hair salon, I want to say like 17, 18, you know, walking out, and her purse got caught on something, and she fell backwards and had actually a spiral fracture of her humerus. So broke her humerus, and it spiral fractured because of the very fact of the way she was walking and the way she was holding her bag. But again, there was a big question of the boyfriend, they questioned the family, but she was an adult, and she said, what happened, you know, and so it wasn't necessarily a DIFUS case, but it was something they did question and evaluate. And then another case was a 7-year-old boy who had a spiral fracture of his femur. And he was walking downstairs and got his foot caught, or playing in the stairs or something, got his foot caught in between railings of the stairs, and fell down the stairs with his foot caught that way, and with the twisting motion. They actually went out. His family was really good about it. He was being held, you know, they'd actually put him in a cast, they'd realigned to put him in a cast, and he could go home, but they were holding him until DIFUS was cleared him, because they actually wanted to go to the home and take pictures and evaluate the scene to make sure that and everybody was very similar in what they said, and even the boy was similar in what he said, and they checked out the scene, and it was what had happened, and you could tell by the way, I guess there was damage to the stairs even and everything, and the family was very good about it. They're like, absolutely, whatever they have to do, because, you know, we didn't do anything, and we want to make sure they feel comfortable with that too. But again, spiral fractures, you know, can happen, but you know, again, it can be a very common indicator of abuse, so it needs to be evaluated. So what do we do when there's a fracture? Well, 2 key things. The 2 ends of the bone have to be put into alignment, and then it's got to be stabilized so that it is able to heal. So how do we put it in alignment? Well, sometimes we do it temporarily with traction or casts, and then they may even need surgery. So here's examples of, like, for example, for hips, we use spica casts. That could be unilateral or bilateral. Or the other thing is surgery. And if they're going to do surgery with fractures, they're going to do something called an ORIF. Anybody know what that means? Open reduction, internal fixation. So it basically means that they're going to go in, and they're going to either put plates and screws, or some sort of, or just screws maybe, or wiring, or something to actually internally, through a surgical procedure, keep the bone in alignment. And then they usually do cast on top of that to help to keep it in alignment outside of that